Today, I'm going to be going over one of the techniques that we use here in the office to adjust the spine. And that technique is called Flexion distraction technique. So, when we typically adjust the spine, either using our hands or an instrument, but this technique is table assisted. So this table has a couple special features, and this technique is used for arthritis of the spine. It's also used for disc issues, and what this does, it restores better motion to the spine, opens up the nerve holes. So we've got Mr. Spine here. I'm going to show you exactly what it looks like. So with 2 flicks of the levers, this is now able to actually rotate at the waist here, and it's able to extend and flex. So what we do is we're actually going to pin one area of the low back, and when we restrict motion up here, the legs are secured to the lower part of the table. That is actually increasing the space in between each vertebra and then bringing those back together. Increasing and bringing those back together. And that continues until the spine is adjusted. So I'm going to come around here and I'm going to show you. So when we increase that motion, that's going to take pressure off of these very sensitive nerves in the spine. And when we restore better motion and take pressure off of those nerves, that's going to be where the healing takes place. So this is a great complement to the regular adjustment, and also it's a great complement if we're doing spinal decompression therapy, because it preps the spine and it helps get better motion into that area for the lower back. So as a review, this is great for arthritis, for those very, very tense areas in the spine that we're still increasing motion and getting better as the care goes along. And it's just a very, very common, it's a very comfortable technique. A lot of our patients, this is the one technique, if they had to just pick one, they would choose for their lower back. Hope that answers your question. That in a nutshell is Flexion distraction technique.